The independent hospital network was formed at a time when many small hospitals and community hospitals had a choice to make about whether they're going to remain independent or they were going to partner up with a larger entity. Some of those entities were for-profit, companies like Columbia. Others were large not-for-profit systems that were forming across the country. Our 5 hospitals worked together to try to remain strong and independent in the communities we serve. We did that by working across a set of 7 common values, and those common values were really aimed at keeping jobs and medical services appropriate to our communities in our communities. Over the past 17 years, our hospitals have worked together in many ways to honor those values, to keep with those principles, and to work together to remain independent and strong in our communities. Here's how our 5 hospitals represent our shared set of values.
Maintaining a local, not-for-profit hospital comes with the responsibility to provide low-cost, high-quality health care for the community and its local employers. With the financial health of local employers in mind, we place a focus on cost-effective management of resources through improving processes and implementing best practices. With Altman, employers can find low health care costs inside their own businesses. Workplace injuries can affect employees, customers, and the bottom line of local businesses. AltWorks Occupational Medicine saves those organizations time and money through injury prevention programs, fully staffed medical clinics, and expert treatment when work-related injuries occur. Keeping costs down for employers is also a result of the unique relationship between Altman Hospital and AltCare. This relationship is known as Exclusive Vertical Integration, or EVI. EVI provides employers with access to Altman's exceptional physicians and facilities.
There are 4 key principles to EVI. Number 1, affordable health care. We achieve this by providing competitive insurance rates combined with one of the lowest cost healthcare delivery systems in the country. Number 2, EVI allows an integrated approach to care delivery by using data to help drive outcomes and quality improvements. Number 3, service. EVI allows for us to have clear brand recognition and continuity for members and patients throughout the different phases of their lives. Number 4, autonomy. EVI allows us to make decisions that are best for our community versus what is best for stockholders or non-local interest groups.
Altman continues to keep its healthcare local, even with its staff and patient care teams. Altman College offers local students associate degree programs in nursing and radiography, as well as a BSN completion program. This provides a pool of talented, locally trained healthcare professionals to Altman as we embark on a time of severe staffing shortages.
The majority of our students are non-traditional. It is their desire to continue to live and work in this area. These facts afford our hospitals and our health systems a ready supply of well-educated professional individuals.
Altman has also concentrated on the supply chain management process in order to reduce and keep costs low.
Through aggressive contract negotiations, utilization of proven supply chain technologies, and by partnering with other network hospitals for aggregate pricing opportunities, Altman Hospital has consistently achieved our low supply cost per adjusted discharge in the region.
Local employers should always expect high-quality, low-cost health care with Altman as we lead our community to improved health.
We are a small community hospital, and we most of the time need to transfer our cardiac patients because we don't have a cardiac cath lab here. So the staff is especially trained to recognize the patient that's having chest pain that probably is going to be cardiac in nature. So immediately they're brought back to a room or transferred over into a room from the emergency room stretcher from the ambulance. And we immediately do our initial EKG, get the patient on the monitor, establish an IV, draw lab work, and quickly identify that this patient is indeed having a STEMI or a heart attack. The physician's right at the bedside, and our goal is to have that patient transferred within 30 minutes from the time they arrive here in the emergency department. The staff here at Altman Oroville are very experienced staff. They all have had multiple years of emergency or critical care experience. They're well trained in early recognition of the cardiac patient needing intervention, and they quickly do their paperwork, contact EMS, and we usually meet our goal within 30 minutes of having them transported to a tertiary facility.
How I look at it is at Altman Orville, our emergency department is actually a portal to the higher level tertiary care centers that would have a catheterization lab, trauma center, stroke center, and the like. But it's nice because we're obviously in a community hospital setting close to home, yet entering into our ER, as I stated, is a portal to actually have access to all of these very advanced care and treatment.
Altman Orville continues to provide rapid diagnoses and appropriate care to meet its goal of transferring cardiac patients within 30 minutes or less. This high-quality medical service is just one of the many ways that we lead our community to improved health.
When we look at results, we really know that there are two things that really affect the results from our patient satisfaction surveys and the information that we get back. It's how engaged the staff is about being an employee here and working with patients, and then also the culture that we have here. Our goal actually is to get 97% of the people to say, hey, we had an excellent experience here.
Initiatives such as bedside shift reports, discharge phone calls, hourly rounding, huddle, those things all kind of tie back to high patient satisfaction because it puts the patient and their family at the center of the care. The huddle that we do every day is a great example of that. We spend about 30 to 45 minutes every day just talking about the patient and their specific needs, and we really individualize the care specific to that patient.
In 2011, we rolled out this program, I Am Pomerene, which basically is taking our values and putting them to action. It's a culture of ownership based on proven methods. The values of Pomerene are to be memorable, accountable, mindful, grateful, and an owner. So as a float, I have the opportunity to work in all these other departments, and it's neat because I can see firsthand how these actually affect individuals, their families. I see nurses treat families as an extension of the patient themselves. It's very powerful, which the patients appreciate that, they embrace that. We have more positive outcomes, I feel, because of that.
On April 15, 2013, Becky went into cardiac arrest, where we were transported by ambulance out to Joel Pomerene, to the ER. There we were greeted by people that we knew.
Yeah, to go there and, well, I don't remember, but Jimmy does, to go there and to see the people, it just makes me feel way better.
My husband and I moved here 20 years ago based on his job opportunity in ophthalmology, but we've stayed here in the community based on the relationships, based on the patients that are here, based on the other physicians that are here.
It's been a blessing, and it's been an amazing opportunity for our patients to receive the quality services in all subspecialties of medicine right here at home, without having them to travel in bad winter days to Cleveland and Akron. The same quality care with the same quality physicians are happening here in our town, servicing our community to the best of our abilities and with the quality care they deserve.
Many of my friends have to travel to distant cities or populated cities and areas, and I just think it's a value to me to be able to have my physicians close by. They give me quality care. I recommend them to other people. My family has used physicians locally. It's just really important to me to be able to depend upon that service.
Alliance Community Hospital is a Plaintree hospital. We're affiliated with the Plaintree organization, and that is, in essence, patient-centered care. And for me, that's what it's all about. That's what makes this place special. That's what makes each and every colleague special. That's what makes every patient coming through the door special. That's what keeps me here.
I think our patients is very fortunate to have this close to home. Our patients are going to be the ultimate judge for how their care is going to be practiced and delivered over the next decade in healthcare, which is going to see a lot of new changes. Alliance Hospital is ready for the future, and partnering with our IHN sister hospitals is going to be a great service for our patients and for our medical staff and for our communities as a whole.
Your local IHN member hospital is the community's center of healthcare and a key contributor to the economic vitality of the region it serves. With just over 1,000 employees, Union Hospital in Dover is by a wide margin the largest employer in Tuscarawas County. Employee families live in every city and village in the area. One of those employees is Chris Beck, Director of Business Development, who began his career at Union Hospital with a part-time job while he completed his college education.
Union Hospital has helped grow my career, and that all began when I was a sophomore in undergrad. Received a phone call about a fitness attendant, part-time fitness attendant position that was open. And from that point on, so many people have invested in me, mentoring me along the way, that it's just been a blast moving from one opportunity to another, and that is only possible due to the leadership at Union Hospital.
The importance of a good job at Union Hospital to these employees and their families is obvious. As a workforce, Union Hospital has a huge impact on the entire local economy. Last year, the hospital paid employees nearly $57 million in wages and benefits. That generated $750,000 in income taxes for the city of Dover. Mayor Rick Homerkhausen says it's a major driver of the city's economy.
Well, the hospital not only is the #1 employer in the city of Dover, it's the #1 employer in the county. And to have that as an asset to the city is extremely important. Our largest utility user, the number of employees they have that create income through the income tax, and all of the associated jobs that are related to the hospital, the doctors that are in the medical park area. It's just an outstanding asset for the city of Dover to have.
The mission of Union Hospital is quality care close to home. Fulfilling our healthcare mission requires more than 1,000 skilled and dedicated employees. As a result, not only is this hospital the healthcare center of the community, it's a significant driver of the local economy, offering more good jobs to more people than any other local organization.
Working together, whether it's sharing management talent or working together to save dollars on supplies, has been really important to the success of the network and the individual hospitals. We know change is inevitable under healthcare reform in our industry, and so the IHN really, I think, sets us up to be successful in the future.